Good afternoon. Topic of my study is relationship between systemic risk factors and different OCT morphological patterns in diabetic macular edema. DME is the most common cause of visual loss in patients with diabetic retinopathy, and OCT enables precise measurement of macular thickness and facilitate detecting macular edema. Based on OCT morphology, DME can be classified into diffuse retinal thickening, cystoid macular edema, and serous macular detachment. Although different patterns of DME and systemic risk factors affecting DME has been studied previously, only a few studies have evaluated the relationship between systemic risk factors and morphological patterns of DME. So, objective of my study is to assess the relationship between systemic risk factors and different morphological patterns of DME. It was a hospital-based cross-sectional study done in outpatient department of ophthalmology in a tertiary eye care center on patients diagnosed with DME confirmed on OCT macula. Patients with macular edema due to causes other than diabetic retinopathy, other macular diseases, patients with prior history of cataract surgery, laser treatment and intravitreal injection, and in whom visualization of fundus is difficult and OCT images are not clear were excluded from the study. The sample size was calculated to be 105 eyes. Socio-demographic details collected, history of diabetes, other comorbidities and smoking noted, fundus examination done by indirect ophthalmoscopy and 9D biomicroscopy, and categorized diabetic retinopathy into mild, moderate, severe, NPDR and PDR. OCT macula categorized based on morphological patterns as described earlier. The investigations including blood pressure, blood sugar, RFT, total cholesterol and microalbuminuria noted, and the values were grouped into two categories based on the normal values. And the proportion of each morphological patterns in different parameters were compared using chi-square test, and those with p-value less than 0.05 were considered statistically significant. Coming to result, out of 105 patients, 61.9% were males and majority were in the age group between 41 to 60 years. And most of the patients had diffuse retinal thickening followed by serous macular detachment and cystoid macular edema. And severe and moderate NPDR found to be the most common stage. Of the systemic risk factors, type of diabetes, duration, treatment, smoking and blood pressure did not show any significant correlation. And those with mild and moderate NPDR had a statistically significant association with diffuse retinal thickening, and PDR had an association with serous macular detachment. Those with increased FPS, creatinine and total cholesterol showed a statistically significant association with cystoid macular edema, and those with increased PPBS had a statistically significant association with diffuse retinal thickening. Coming to discussion, in a similar study by Lakshmi et al., majority of the patient had DRT followed by CME and SMD, and increased FBS and triglyceridemia showed positive correlation to CME, which was similar to my study, and increased PPBS was significantly associated with SMD, whereas in my study it was associated with DRT, and abnormal blood urea showed a positive correlation to DRT. In another study by Akandi et al., majority of the patient had CME, and albuminuria was seen at a significantly higher rate in patients with DRT. Limitations: sample size was small, and sampling in a tertiary center may not represent the entire population, and it was just a cross-sectional study. To conclude, better understanding and modification of these systemic risk factors may help to improve the treatment outcomes. These are my references. Thank you.
Could you come to the conclusion that you made from your study? Means, did your study help you come to this conclusion that you made?
So if we but focus on the risk factors, we can predict the outcomes, sir, and
yeah. What was the aim of your study?
To study the relationship between the systemic risk factors and different morphological patterns.
Yeah, and then what was your conclusion based on that? Based on your aim, what did you find?
this increased FPS and creatinine had an association with cystoid macular edema, and PPBS had an association with diffuse retinal thickening. And if we modified that risk factors,
Yeah, no, that you haven't studied. So you can only conclude that first part from your study. The rest of it is you're just adding common sense. It's not your conclusion. Okay.